So the intention of this short presentation is to just give you a sort of key outline of the issues you're going to be considering. And the most important question for this afternoon is about the mode, in terms of whether you believe it would be better to have only physician-assisted suicide or only euthanasia, or a choice between the two. And then the other important issues that you're going to be thinking about is who decides who should be eligible, and who assesses the patient who's made a request to have a form of assisted dying, whatever form you think is appropriate, and whether that's just, for example, the doctor who is in charge of looking after the patient, or perhaps two doctors, or whether another body such as a court or tribunal should have a role in assessing who should be able to access this, who should be involved in then providing it in terms of assisting the patient to take their own life with physician-assisted suicide, or indeed administering the fatal drugs in the case of euthanasia. Should there be a requirement for cooling off period, as they have in some jurisdictions where it's lawful, and should there be an option for an advanced decision? So we're going to be looking at those issues. And then there are just some key assumptions based on other models of lawful assisted dying. Things like, doctors being able to conscientiously object, that I'm going to run through. So mode is really important, and as you've heard over the past few weeks, different places have different lawful modes of assisted dying. So, for example, in Oregon, only physician-assisted suicide is lawful, whereas in Belgium, only euthanasia is lawful. And in other countries, such as Canada and the Netherlands, patients can choose whether they wish to have physician-assisted suicide or euthanasia. And in terms of additional safeguards and regulation, who decides whether an individual who requests assisted dying should be eligible for it? So in most other places, doctors are responsible for determining whether a patient who requests an assisted death should be allowed to have one. In Canada, nurse practitioners can also decide this important question, but there is the possibility that there should be another form of approval. So once the medical approval has been established, should a court or perhaps a specialist tribunal have to assess the patient and make the final decision about whether that person should be allowed to have an assisted death. And then following on from that, should there be review, and what form of scrutiny after the death has taken place should be put in place? The next issue is who can assist the patient in cases of physician-assisted suicide, or in cases of euthanasia, who can administer the euthanasia. So should this only be doctors? Again, Oregon, for example, only permits doctors. The Netherlands also only permits doctors. Or should nurse practitioners or some form of specialist nurse also be permitted to provide or assist and administer assisted dying? Again, Canada allows nurse practitioners to do this. Alternatively, you could have a sort of approach where lay people can get involved. So in Switzerland, for example, after the prescription has been provided by the doctor in their model for physician-assisted suicide, a non-qualified person is permitted to help. So that's another option that we'll be asking you to consider. Should there be a cooling off period? So in Oregon, for example, it's necessary to have a period before the first request and then the second request for the patient to reflect and make very sure that that is what they want to do. So should we require that in Jersey or not, or should it depend on the circumstances? So for example, I think you heard that in Canada, they'd recently taken the decision to change the requirement for a cooling off period in certain circumstances. So if a patient, for example, was likely to die very, very soon, it would obviously make it impossible for them to have the assisted death if you made, if they were subject to a lengthy cooling off period. We've also heard how in some countries it's possible to have assisted dying at a point where you've lost mental capacity if you've created an advanced decision. So, for example, in the Netherlands, when people are diagnosed with Alzheimer's or dementia, they can create a legally binding advanced decision requesting euthanasia at a point in the future when they no longer have mental capacity. So do you think that should be a possibility or not? In Belgium, for example, they allow people to create an advanced decision should they fall into an irreversible coma. And obviously being in a coma, they wouldn't be able to request euthanasia. So should this be definitely no? Always yes, irrespective of the circumstances, or possibly yes, only under certain circumstances. And then there are a few assumptions. Now, these are things that you can consider, and they're really important actually, but we haven't necessarily got time to discuss them today in full, but we thought it would help you to know that there are certain assumptions that we might expect to be included. So, for example, conscientious objection for doctors and possibly nurses if they're involved, and possibly even pharmacists. So, should individuals have the option to say, no, I don't agree with assisted dying, I don't want to take part in it. So, for example, at the moment, the law on abortion allows individual doctors and nurses and midwives to conscientiously object in certain circumstances from being involved in the provision of abortion services. And in all countries where they have lawful assisted dying, they do allow doctors and others to conscientiously object and not take part. Where should people be permitted to have an assisted death? Many people want to die at home, so we would assume there would be an option for individuals to die at home, provided this was possible, depending on the clinical and practical circumstances affecting that individual. And we might also assume that the request would be made in writing and also be witnessed by an independent person, so that you could safeguard against, for example, coercion and relatives or healthcare professionals who were putting pressure on the patient to ask for an assisted death. And we would also assume that it would be possible to withdraw a request for assisted dying at any time, and this would normally be in writing, although obviously we would accept potentially a request not in writing if it was if it demonstrated that that person had changed their mind. And then there would be a system in place, we assume, for reporting on assisted dying, so that we could get the government could collect data and make sure that the experiences and the phenomenon of lawful assisted dying was being carried out legally and ethically. And that's it, thank you. I will be available for questions if you have anything you'd like to ask me during this afternoon.